Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know about. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee. Currently, I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. When it comes to solving the riddle of MS, many of you already know that research is the engine that drives the future. But you may be wondering where MS research is actually presented. The European Committee for Treatment and Research in Multiple Sclerosis, or ECTRIMS, and the Consortium of MS Centers, or CMSC, recently held their 2021 annual meetings. And today, Dr. Bruce Bebo and Dr. Kathy Zakowski from the National MS Society's research team are joining us with an update on the research that was presented at both of these important meetings. First, I'd like to welcome Dr. Bruce Bebo. Thanks for joining us today, Bruce.
Hi, John. Good to be with you. Good to be with everyone.
The National MS Society's Pathways to Cures initiative has been described as a research roadmap. And during the ECTRIMS meeting, there was progress reported on this effort to stop MS, restore lost function, and end MS forever. Bruce, can you get us started by explaining what Pathways to Cures is all about?
Sure, John. Thanks for the question. So the goal really of the Pathways to Cures initiative is to establish a clear vision, a vision of the most promising research that will ultimately lead to cures for everyone living with MS, and inspire the global MS movement to collaborate and coordinate investments focused on answering questions that will reveal insights leading to cures for MS. And this plan, it describes gaps in our knowledge, milestones, accelerators, things that will speed solutions and eventually cures for MS. And as well as, John, preventing, and we'll talk more about that, I know, here in a minute, about preventing MS for future generations. So there are three pathways, as you mentioned: stop, restore, and end, that are described in the roadmap.
Well, let's start by talking about the research focused on stopping MS. Some presentations at ECTRIMS focused on the brain's immune cells called microglia. What are microglia, and what did you hear about new therapies designed to stop MS by targeting microglia?
Sure. So microglia, there's another cell we ought to all really be familiar with. These are specialized immune cells that are found within the central nervous system. And they're responsible really for removing debris, removing damaged neurons. They're the central nervous system's immune system. They help clear infections. They're really important for maintaining the health of the central nervous system. Think of them a little bit like our immune sort of sentinels for the central nervous system. And there's growing evidence that these cells become dysregulated in MS, and interestingly enough, in other neurodegenerative diseases as well, and that they are a key driver of the smoldering, if you will, or insidious damage to the nervous system that we think is driving progressive MS, the progressive form or phase of MS. And some of the secrets to these cells, John, are starting to be revealed. There are a couple of studies at ECTRIMS maybe to share with you. So there's a super interesting study from a team at the Cleveland Clinic that was looking at gene activation in microglial cells in lesions, in MS lesions. And they found differences in gene expression depending on where the lesions were located and where these cells are in a lesion, that are revealing clues to pathways that could be targets for therapy that would regulate the function of those cells. There's another interesting study from the University of Massachusetts that described how an immune mediator called complement that can team up with microglial cells to damage the nerve synapses and interrupt brain circuitry in MS. And this complement, I think people are going to start hearing a lot more about this. It's a very interesting drug target for progressive MS, and complements a study that was published in the really prestigious journal Nature a few weeks ago from the NIH that also pointed to complement as a key player in lesions that might be driving progression.
In previous Ask an MS Expert programs, we've talked about the role of different types of stem cells as a potential treatment for MS. During ECTRIMS, research about using mesenchymal stem cells as nerve protection was shared. Bruce, what are mesenchymal stem cells, and how is this procedure different from AHSCT or bone marrow transplant?
Sure. So mesenchymal stem cells, or MSCs for short, can be derived from a lot of different sources, but they're commonly derived from the bone marrow. And what we're talking about here is manipulating these cells in the laboratory, really to turn them into, if you think about it, sort of factories that secrete factors that we think can suppress inflammation and at the same time perhaps promote repair in the central nervous system. So there are a number of ongoing clinical trials testing different preparations of mesenchymal stem cells, or MSCs, for the treatment of MS. And maybe important to share also, John, that the evidence is suggesting that injecting these cells directly into the spinal fluid is probably the most promising approach, and has shown evidence has been presented that it could be helpful for both relapsing and progressive forms of MS. So specifically at ECTRIMS, Dr. Jeffrey Cohen from Cleveland Clinic reported results from a study of a cell-based approach, an MSC-based approach for myelin repair that's being pursued by a company called Brainstorm Cell Therapeutics. So this was a trial of 18 people with progressive forms of MS that were treated with MSCs that were derived from their own bone marrow, so you don't have any issues with transplant rejection. Again, they're treated in a lab with their sort of proprietary mix of factors to elicit a secretion of a cocktail of factors that are thought to promote myelin repair or maybe provide neuroprotection. So what was reported at the meeting was that the treatment was safe, and this really was the primary outcome of the study. And then they showed signs of improvement in cognition and vision and mobility. The society supported an interesting add-on study to measure the levels of biomarkers in the spinal fluid to get a sense for what factors are being produced and how much of them. And the team reported interesting changes in these biomarkers that suggested a shift in the chemical environment and the central nervous system that favors neuroprotection and repair. And this is one of a number of ongoing approaches testing MSCs in MS. And then just so to differentiate this from autologous hematopoietic stem cell transplantation, or AHSCT, this is a very different approach. It kind of gets lumped in with stem cells, but it's very different. So the goal of this treatment really is to reset the immune system, and it involves a mobilizing step. So this is mobilizing stem cells to migrate from the bone marrow into the blood, and then collecting and storing the blood. A conditioning step, which is typically some cocktail of chemotherapy agents that either partially or in some cases fully destroy the existing immune system. And then what I would call a recovery step, which is reintroducing those saved blood, that's enriched in stem cells that repopulates the immune system. And there's more and more evidence to suggest that this new immune system that's established lacks the cells that cause the damage in MS. And some people with very active relapsing forms of MS that fail to respond to some of the pharmaceutical treatments that we have, some people are finding long-term remission using this AHSCT strategy.
This year's ECTRIMS meeting emphasized the growing awareness about health disparities in MS. What can you tell us about research that's focused on how MS is experienced differently among people of different races and the impact of the social determinants of health?
Yeah, thanks for asking that question, John. There certainly is a growing appreciation, a growing awareness, attention being pointed in the direction of how race, ethnicity, socioeconomic factors, social determinants of health really are contributing to differences in outcomes in MS. And this was a topic of many presentations at this year's meeting. I'll point to a few. A group at the Icahn School of Medicine at Mount Sinai studied, was trying to answer the question whether an aggressive disease course that has been reported in Black people with MS might be related to socioeconomic factors or other types of factors. So they reported a study of that included 60 Black people with MS and 60 white people in MS. And even when they accounted for and used very complex models to account for socioeconomic factors, the Black people in the study still had more severe disability than white people. And so what are the other factors in addition, of course, the socioeconomic factors that are driving this is a question that we need to answer and put some resources to. There's another study from the Cleveland Clinic that used an approach called the Area Deprivation Index. This is a measure of socioeconomic factors in the United States that one can derive from zip codes about where people live, and it identifies sort of the least and most disadvantaged neighborhoods, and went to look at links between those factors and clinical measures and quality of life in 2,000 people. And what they learned really was that people with MS that are living in the more disadvantaged neighborhoods had worse outcomes. So this really is unacceptable, we're working on developing strategies to understand this question better and provide resources to try to overcome it.
MS has an at-risk period prior to its actual onset. Presenters at ECTRIMS touched on various efforts to map out genetic, lifestyle, and environmental factors that contribute to the risk of developing MS and eventually enable earlier interventions that may prevent the onset of MS. Bruce, what did you hear about ending MS by preventing MS?
Yeah, great. I'm very excited about this area. We know that the time from an exposure to a risk factor for MS and the onset of disease can be years, can be decades even. And this is a window of opportunity that we have to intervene earlier, perhaps, as you mentioned, John, before the onset of clinical signs of MS, a time where we may be able to slow down or stop the disease-causing immune response and potentially delay the onset of MS or even prevent the onset of MS. So there were a lot of presentations at ECTRIMS that touched on efforts to map out the genetic, lifestyle, and environmental factors that contribute to the risk of developing MS. And again, this information will enable earlier interventions that may eventually lead to prevention. One idea, and I know people have heard this before, is the observation that people infected with Epstein-Barr virus have a higher risk for developing MS. And but the question, and this was a really interesting study at ECTRIMS, was we still don't know if this is causal, John, if it's an association with MS or whether it's actually related or a causal factor in MS. And so there was a real interesting study from Harvard that asked this question about whether EBV infection occurs before any of the unrecognized symptoms of MS or occurs before any evidence of damage to the nervous system. So if EBV is the cause or is a causal factor of MS, then the infection should come before any signs of any symptoms or any signs of damage to the nervous system. So the team from the Harvard Public Health School looked for EBV antibodies in a series of stored blood samples from military personnel who later developed MS. and compared them to those who didn't. And they looked at the concentration of a biomarker called neurofilament light chain, which indicates that nerve damage has occurred. And so what they wanted to do was see whether NFL levels were elevated before or after the time of that primary EBV infection in the individuals who went on later to develop MS. And what they found was there were no signs of nerve damage before the primary EBV infection in individuals who later developed MS. So this is consistent. It's still not proving causality, but it's another piece of evidence that EBV may be a trigger rather than a consequence or an association. And I'll just share that there's a progress being made on vaccines for EBV that could prove once and for all whether EBV infection is a trigger for MS. And maybe just one quick other additional anecdote, John, in addition to, and while we're on the EBV topic, sort of in addition to thinking of EBV as a potential risk factor or trigger, there's another hypothesis that actually EBV infected cells may have a role in causing the damage in the central nervous system that causes MS. And so, one idea would be targeting EBV infected cells could be another strategy that could be a novel therapy for MS. So Dr. Amit Bar-Or, who's at the University of Pennsylvania, reported on behalf of a company called Atara Biotherapeutics that an early phase clinical trial that primarily looking at the safety, but also looking at efficacy of an agent that targets and kills EBV infected cells. And what they reported was the treatment was safe and well tolerated, which was the primary purpose of the study. But there were some signals in the MRI scans and other signals that suggest there might be a positive response. And there's an ongoing phase 2 trial right now that's designed to look at efficacy that we'll report out soon that I'm looking forward to.
Well, thank you, Bruce. Now I'd like to invite Dr. Kathy Zakowski to join me. Welcome, Kathy, and thanks for being with us today.
Hi, John. Thank you for having me. It's great to be here.
The Consortium of MS Centers annual meeting, also known as CMSC, is different than the ECTRIMS meeting. Can you tell us how this meeting is unique among other MS conferences?
Yeah, I feel like it's an important caveat to bring out because it is a very different meeting. The CMSC meeting, invites healthcare providers as well as researchers to come together and share research progress, but also the meeting provides continuing education to MS healthcare providers. And the focus of this meeting is really to identify research and progress in MS that is incorporating comprehensive care. So this means healthcare providers from a variety of disciplines, including physicians and nurses, but also physical therapists, occupational therapists, speech therapists, psychologists, and exercise physiologists, to name a few. But the idea is, we all come from a different angle, but we need to use research and evidence to guide the way we treat people with MS, and that's really the focus of that meeting.
A lot of people who are living with MS are on a mission to find the so-called MS diet. Did you see or hear anything at the CMSC meeting that focused on diet?
Yeah, I hear that question a lot, and there were several things. I'll highlight a couple of things for everybody. One, you might remember that previously researchers from the University of Iowa published results from a National MS Society funded 36-week controlled clinical trial that showed that compared the SWANK, low saturated fat diet with the Wahls elimination modified Paleolithic diet, and that both diets reduced fatigue. But at this meeting, Dr. Tyler Titcomb, who's from the team in Iowa, presented additional results from that study. He looked at not only motor and cognitive fatigue, but he also looked at how patient-reported outcomes about cognition. And what he showed is that both diets, again, led to significant reductions in both motor and cognitive fatigue, as well as cognitive dysfunction. So it's just like an extra step that I wanted everyone to hear about. Also, the National MS Society has a wellness research working group, and within that there is a nutrition wellness subgroup. And this is a group of experts that come together monthly to try to discuss questions related to nutrition and MS. And that group presented at this meeting. What they did is they reviewed the medical literature on dietary intervention studies in MS. They summarized each trial in practical and easy to understand terms, and they created general guidance on how to put that information into daily practice. And I just wanted to encourage everyone, they presented this at the meeting, but this information is available to everyone on the National MS Society website. It will allow people to stay kind of abreast of the latest movement and research in terms of diet. I wanted to bring up one last study, if I can throw it in. So Dr. Rebecca Spain also looked at a supplement called lipoic acid. And there's a lot of questions about how supplements factor into this idea of diet and nutrition in MS. And this study is kind of building on a smaller pilot study that she did, where she showed that this supplement, lipoic acid, which is an antioxidant that's derived from food that we eat, or you can take it as a supplement. And we know that antioxidants may have some kind of neuroprotective features that are important in MS. This previous pilot trial showed that brain atrophy slowed in people with MS when people were on this supplement. So now they're looking at a larger group and trying to look at clinical progression. So measuring things like walking and falls, things that are more clinically relevant. And what they had to do, and she reported on, was that they actually had to halt the study briefly because a few people had some kidney dysfunction. And I bring this up because I think it's important for people to realize that that team had implemented really stringent monitoring to identify these kinds of things early. And so now this has been resolved, things were improved, and now they're back recruiting for the study, and they still need to finish the study in a very safe way. And I guess I feel like it's important to know that, for people to know that, one, supplements need monitoring just like drugs do, and two, that at a meeting like this, it's important that researchers share the pros and cons of how the work is going, so that we really can move forward and progress things as quickly as possible.
We know that exercise is important for people living with MS. It's been shown to improve health and overall quality of life. Can you tell us about any new studies that were presented at the CMSC meeting that focused on exercise?
Yes, I do have a couple things that I wanted to share. One I thought was interesting, just because it was a little unexpected. This group, Dr. Gloria Howe from the University of Washington, really explored, the question of, we know we need to exercise, and we have evidence now that, exercise can improve symptoms in MS, but are people actually exercising? And that was the question that Dr. Howe started with. So what they did is they tested this idea of what they called a physical activity vital sign. What they really did is they asked people about the frequency with which they conducted or did moderate or strenuous exercise that got you to be a little bit more out of breath than normal, with the hope that if they had standardized questions that could allow healthcare providers to understand this better, that these could be implemented in all MS clinics. And they did this in over 1,000 people with MS. And let me tell you the results, because this was what I found so shocking. They found that only 30% of people met the U.S. National Physical Activity Guidelines, which are, of course, are the 150 minutes per week of exercise. But that might not be as surprising as the next fact. They found that 25% of the sample they have exercised 0 minutes per week. So, for me, it really showed that, we need to figure out how to get people moving. And these kinds of studies are necessary to facilitate and motivate strategies to not only get people to exercise, but to help them sustain doing that exercise. So there's another a little more uplifting study that I want to also share. Dr. Anna Kratz from the University of Michigan, she reviewed the research on exercise interventions that improve fatigue in people with MS. And she highlighted a pilot study, so a smaller study, in 20 people with MS who had fatigue and participated in 8 sessions of exercise therapy, so 8 weeks of exercise. And the exercise was aerobic as well as resistance training. And they had two groups. One, the exercise was delivered via a telephone, and the exercise was delivered in person. And the telephone group, what happened is they received a phone call once a week where they talked with a physical therapist. They could, describe issues they might have, and the therapist would provide a progression of what the next set of exercises are that they need to do. And what they found was that fatigue reduced significantly in both groups. So along with changes and improvements in depression and pain and sleep. So I found this interesting because I was surprised. I wouldn't have thought that a group that was provided information just via telephone would really see improvements. But her study really shows that it kind of opens the door for allowing programs like that to be delivered to people who can't, who don't have access to large MS centers where there are these programs implemented in person.
Well, thank you, Kathy. I'd like to thank you and Dr. Bruce Bebo for being with us today.
Thank you.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways to get involved, and upcoming events near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Bruce Bebo and Dr. Kathy Zakowski for joining us today. Please remember that a recording of this webinar is going to be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, well, you'll see that link to the survey pinned to the comments section. On YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Bruce Bebo, Dr. Kathy Zakowski, and the National MS Society, I want to thank you once again for joining us. Please stay safe,